Okay, I'll call the meeting to order. And, not having a pass quorum, we'll, skip the approval of the minutes and get them to our next one. Want to welcome Dr. Art Boerner. Thank you. And, we're, looking forward to his expertise.
Absolutely.
So, anyway, we'll moving forward.
Public comments? Public comments? There are none? Nothing?
Nope.
Chris? None? Okay.
Okay.
Public comments?
Okay. And I have the rest of this here. What do we got on,
New business, budget, 2025 budget.
budget? Everybody got a copy of that? Everybody know it in detail now?
I hope so.
Memorized. Yeah. All right.
All right. You
All
want to
right. You want to lead the discussion?
You want to go through fund by fund? Probably the best thing to do. So Fund 1151 is the public safety fund. This is kind of a relic fund from the ambulance service going way back. And it just has, $4,857 and change left in it. And basically what I did was put in for some supplies because our paramedic actually does ambulance inspections. And he has to check the temperature of the ambulance and a couple other things, and TPA license and everything. So some of the supplies are in there to pay for his needs, and also because there's so much going on in EMS, our attorney fees are rising at a great rate. So I'm going to use this money to pay for the attorney fees as it relates to the EMS service. That's where most of our attorney fees are going right now. So that's
So is this something that once you spend it, it's gone?
it'll be gone.
There
Yeah.
won't be anything like that.
The only way that would change is if the commissioners add back into the public safety ordinance a fee to permit ambulances again. But currently, since the ambulance provider that you have is a not-for-profit, they would not pay that fee, so it doesn't really matter at this point. Now, they can go back and change it, and that might be something we might need to consider down the road. Just because, right now I can absorb the cost of having somebody inspect these ambulances in our 1159 budget, but that may not always hold true. So it's an option out there.
But if you're going to replace this, it would have to be fees or something.
It would have to be fee based. This is not a tax-based fund at all. Yes.
Legal fees are in reference to what's happening with the county sheriff, ex-county sheriff.
No, this is related to the EMS provider. We oversee the EMS system in the county as far as our operational.
But wasn't you involved in that?
He was, but we're not tied to that particular issue. We just are dealing with the fallout of EMS provider struggling to provide service in the county to some degree.
And does any of that reflect previous actions?
I would think, yeah, it definitely is taxing their ability. Yes, that absolutely is. Yeah.
Are we represented by council?
Yes.
Would you ask council to see if there's any way to put in a petition to recoup some of those funds and the proceedings that are currently going on?
Yep, absolutely. Yep. Will do.
I think that probably ought to be noted. We've had a problem with employees that we participated in rectifying the situation. You want to give a little detail to the problem that we had?
As far as the ambulance
Employees
providers.
taken off,
What's that?
employees leaving the,
Oh, the ambulance service?
yeah.
I think that's widely in the news. What happened was, New Albany canceled the contract with New Chapel. And when they lost that contract, a lot of the employees at New Chapel, they did both fire and EMS service. And then like 6:30 on a Friday night, 9 or 10 of those employees went to the fire service under the fire district in New Albany and left New Chapel. So when that happened, Matt Owen had reached out to all the stakeholders, the mayor, the health department, the commissioners, folks, to let us know that because of that, there was definitely going to be a strain on the system. And he asked for help. And so we started making phone calls and got mutual aid along with Scott County, Harrison, Amir, Tri-County, or Tri-Township Fire. He's really stepped up, done a great job as far as, helping us out. New Washington has stepped up quite a bit. So right now, the job forms are increasing. Job forms, that's basically what people are, 911 sends us forms saying this response time's 18 minutes, or this response time's 15 minutes, or just a general complaint about the service that was provided. Those are increasing, which I expect that to happen because of the shortfall of employees. But I will say that right now it's been pretty stable. I've been talking to our EMA, I'm talking to Central, I'm always gauging to see what's happening. It's definitely not optimal. We've definitely got some serious problems. We've got some runtime problems, but we're not collapsing by any means at this point. So we're stabilizing. I talked to Matt recently. I'm, always checking in to see what's going on. Where do you think you're at? We're constantly watching it. Dr. Yazel put out a letter on June 5th, I think, basically giving everybody an update about what's going on. If you have that in front of you. Nothing's really changed as far as that goes. We're still kind of at that point. We're not as solid as I'd like to see us be, but we're not going down the hill at an exponential rate either at this point. I do have a little bit of concern that I know that they're understaffed, and when you keep running those staff on an EMS unit, it's going to wear on them, and the patient care might start to deteriorate, and even worse, they may have some more people quit, which could get us into a worse situation. So,
where's our supply of EMS?
Right.
Coming from?
EMS is really challenging. We have TransCare is in the area.
No. What educational system within Clark County or Floyd County are training EMS personnel?
Ivy Tech just had a class, I believe, graduate last Saturday, and then New Chapel is trying to do the training institute through the hospital, and they just signed their recommendation, signed recommendation for New Chapel to start their training institute. And Harrison County actually has a pretty stout program there too. So
are we reaching out to those people?
We are definitely trying to encourage people to get into those programs. It's up to New Chapel to hire them. So we don't have a county-based EMS system. It's contract.
So it's out of our.
It's out of our.
Do we want it back in our purview?
There's definitely some talk about a county-run EMS system, and we have an EMS subcommittee that's actually discussing that in great depth. Figure out what's the best way to deal with EMS in Clark County going forward. There's talk about a county run system, but we're actually trying to get some numbers, see what that looks like, take that to the commissioners, because they would be the ones that would be funding it. We're looking at a kind of a hybrid, having contract EMS out there in the areas that don't want to buy EMS. So say Tri-Township definitely wants to do their own area. So maybe they take care of their own, but maybe Charlestown doesn't, and then maybe the contract provider will take care of Charlestown. So we might end up with a hybrid type situation. I can see that being a viable solution. I just don't know that just a straight contract EMS provider going forward is what the preference of the subcommittee is at this point. Just because what's happening, if you have one provider and they're having some issues, there's no backup really. We're just lucky we have Tri-Township and New Washington. So absent of them, we've been in a real crisis.
What's the public perception of all this? Is that known?
It's very widely known. There's a lot of folks that are very upset about the situation. I don't disagree. It's definitely a challenge. It's like I was saying earlier, EMS in Clark County has always been a struggle. I think EMS holistically across the state and probably across the nation is always going to be a struggle, just because it's so underfunded. The pay for paramedics is not great. EMTs is even worse. There's just not a lot of folks out there that want to do it, and it's very hard work. It's backbreaking work. I mean, these folks run 5, 6, 10 years, and they're picking up individuals, in rolling on gurneys, and it just attacks your body. It's always a challenge. It's always going to be a challenge. But the biggest challenge usually is finance. Because it just never gets funded the way it needs to be funded.
I have the perception that over the years, what we have done is added units, and we really haven't changed the process of what the whole EMS entity looks like.
Right.
We've done that. I think we probably ought to spend some time this year analyzing what it ought to look like.
We are, and we got the job forms, we get the reports in central law now, the run times for this area. So now we can kind of figure out, maybe we need to stage an ambulance up there in Henderville, 24/7, needs to have a station up there. Because Henderville boarding are always gonna have long response times because it's so far out. So we're looking at that. At the end of the day though, I think these fire departments that are wanting to do this, I think is gonna be an awful situation for the county, just because they're already here, they're connected to the community, and they do, they have that passion, that's why they're in fire. So, your patient quality of care will be high. It just has a lot of benefit looking at it from that perspective. But that's not the answer though, in totality. We're gonna have some contract work in there, or the county's gonna have to have
That's right.
a portion of it, one or the other. And again, that's what the subcommittee's talking about. They're coming up with recommendations, and we're going to keep working it out and making sure all this is done in the public, taking it to the commissioners, taking it to you folks, and making sure that everybody that needs to be involved is involved. And we come up with reasonable solutions.
One thing you might want to consider doing is just be in touch with the hospital emergency room and ask them specifically as people come through, did you come in a private vehicle or did you come in?
Right.
And see if those numbers are increasing. Because what I hear out in the public is that if you got to get to the hospital, you drive yourself or have somebody else get you there. But that just shouldn't be the case.
Right.
I mean, this county there's enough desire, and I think there's enough economic support to correct that problem.
Sure. Absolutely. And luckily, the person that oversees the ER's management for the EMS side of the Pomona is on our advisory committee. So I can ask him to start putting those numbers together for us.
I mean, those would be great numbers.
Yeah.
To have available.
Absolutely.
Anything else? Anything else?
So you want to move on to 1159? So 1159 is our base health fund. It is, every county has an 1159 fund. It is the tax levy for the health department. So there was some talk about a 4% raise for the county employees, but it was never really approved. But at least there was some discussion with the council. So based on that, what I did 4%, split the budget, hoping that actually happens. But I also like to keep my budgets neutral. I don't like to increase unless I actually have to. You know how we operate. We get grants first, and then we ask for tax dollars last. So I went through and we did the 4%, and I looked at other items in our budget to see if I can't reduce those and offset it with some other programs, like grants that might help us out fund some of this stuff. So we're pretty close to budget neutral until last year with 4% in it. But the rest of the funding it's our contract services, it's cleaning, it's when we have ice storms, take care of the parking lot, all that kind of stuff. The lights, utilities, all that's in this fund.
I just had a question about, and I don't wanna get ahead of you, but I was looking at the license and permits, and that number like doubled. Is that
License permits,
Yeah,
which I don't know.
well, I was looking at,
Are you looking at the revenue form?
on which one, yeah. Well, it's an estimate of miscellaneous revenues.
Okay,
Yeah,
so what
that's
that form is I have to turn it into the gateway, into the DLGF, what we anticipate that we're gonna bring in revenue wise. So I have to basically guess how much revenue we're gonna get from restaurant permits, file records, and this and that. That's stable, because it's done in 18 months increments, that form is. So I have to do the rest of this year, and then I have to do all of 2025. So I have to guesstimate from July to the end of this year, and all of 2025. That's why
that's why
it
it
does.
is, okay,
Yes.
alright.
So because that also affects the tax rate. And again, we always try and find ways to, for fees, lowers tax rate. That's why.
So you're talking about, you talking about like food trucks? Or
Yes,
is that-
the
okay.
restaurants,
Alright.
you know, all, everything up on Veterans Parkway, all the restaurants are permitted. Vital records, birth and death records. We charge $20 for a TB test. It's things like that.
So, okay.
Yeah.
So it's all included?
It's all
Vital records and the food trucks are all in one?
Property tax circuit breaker, I don't know, could you explain that to me?
So the circuit breaker is, we have an approved budget, and then what happens is sometime usually April or May, the circuit breaker kicks in. So they may say the health department gets $100,000 budget, right? That's what I get to operate on. That's what they say we're gonna have. Then the circuit breaker hits. The circuit breaker could be $20,000. Well, I'll find that out in like April, May, sometime around then. Then I gotta cut my budget $20,000 and make it to the end of the year. They're out. So that's what the circuit breaker is. So the approved budget is never really an approved budget. You really don't know what you're gonna get. And you gotta be mindful of the fact that, you know, property taxes may not be paid as anticipated. Values of homes may go down, some tax rate may go down. So you always have to run very lean in the very beginning of the year, just to hold off and know that we're gonna get hit and make it to the end of the year.
Okay. There's a line item, on the second page, contract services, what's that?
Contract services, what I was talking about earlier, that's your being in the building, that's taking care of the parking lot, that's, the alarm system, the elevator, making sure we have that checked every month, and then major work done on quarterly, it's that stuff. Just what it takes to operate.
Any other questions?
Done? All right, 1161. This one is $2,633,722. We went over this at the last meeting. We can go over it again, but this is the new state funding that health departments received that opted in, and this is really to really increase public health in communities across the state. And like I talked about last time, our goal now is to not just be reactive, it's more about being preventative. We're really focusing in on, you know, cancer screenings, we're gonna focus in on trying to reduce heart disease, diabetes, and all those chronic illnesses. That's where we're putting a lot of our dollars. We're gonna be giving grants out to individuals, like the hospital may do something for us. Like I really wanna get the hospital to do mobile cancer screenings. I know Norton's has a unit across the river, but for whatever reason, DOT won't let them come across here to do it on our side of the river. So I'm trying to make that work, and if we can help fund whatever it takes to get this unit over here, we can get some stuff done in neighborhoods, like, you know, out in the rural areas of the county. I'd really like to make that happen. So some of this funding is for those types of programs. Our maternal health, child health, we're putting about $200,000 or $250,000 into that, trying to expand access to care. Very much so in the early in the pregnancy. So that's where a lot of dollars are gonna be going. We're even looking at gun safety, making sure, you know, if somebody has firearms and they can't afford gun locks, maybe we can help out getting gun locks. Something, those types of programs. Just looking at injury and trauma prevention in the county and chronic disease. And that's something that's very new for most health departments across the state, including us. We have never been on the preventive side of the measure very much. We've never had funding to do that. And with this kind of funding, we can now do that. And I'm hoping we're not gonna see change in 2025, we're not gonna see change in 2026. This is more of a long-term endeavor, but I think in the long term, we're gonna see some changes. So I hope positive.
I just had a question about the salaries and this.
Yeah.
So are you going to, and I'm not saying you should not do this, I don't mean to say it, but will these salaries be on top of what's in the health fund?
Yes, so this is the market adjustments that were done last year.
Okay. And I was gonna say, cause you guys don't usually get raises.
Correct.
Normally, but this would be a good time to.
Right, and we did that last year.
Okay.
These are just carryovers from the previous year. And these have a 4% added to them as well, just because most employees in the health department get 2 paychecks because they're coming from 2 different funds.
Okay.
So basically, when we did the market adjustments last year, I tried to avoid the tax base and use the state fund,
Okay.
and that's what we did here.
Okay.
Can I just make a comment about access to healthcare coverage for pregnant patients is, unless it's changed since I left, closed my practice, that's a very easy thing to obtain.
It is, but the problem we're noticing is individuals who, some individuals that are struggling, maybe they're going to family health or they're going to Life Springs, there's a 2 to 4 week gap in care to delivery, is what we're seeing. And you being an OBGYN, the importance there is critical that they're getting care all the way to the end, so we're trying to bridge that gap. Well, we also have some cultural issues too, where some individuals don't go to the doctor until they're way into pregnancy. And we really want to spend some money on educating these individuals and these populations to make sure that they know that that is the proper thing to do, is to seek care very early on and not wait. And so we want to try and find a way to eliminate that barrier to have more positive outcomes when it comes to birth.
That's critical.
Absolutely. And that's why we're working with our partners, Life Springs and Family Health, because they work with individuals that are underinsured or uninsured. And that's generally where we see those issues, where they're waiting till they're so far in that something that could have changed course earlier didn't happen, and now we have an outcome that's not desirable, where we could have paid for some prenatal vitamins or whatever. Could have made a difference that way.
They're free.
They usually are.
Yeah.
But again, they often don't know, and they're not connected, and we've got to make these connections.
So is it, am I hearing this correctly, that Life Springs potentially could have a patient that they discover is pregnant?
Correct.
What other facility?
Family Health.
Family Health.
Yeah.
Okay. One thing you might want to consider is if you could get a mobile ultrasound unit.
Okay.
That could go to those places to confirm the existence of a pregnancy.
Okay.
Have the individual see the heartbeat moving in the child.
Okay.
That may be the motivation necessary to get things going.
Okay. And maybe that's something that I could try and contract out with an individual. And I'd have deliverables obviously. But, I definitely could look into that.
There are a lot of ultrasound techs who are independent, working in various doctors' offices.
Right.
Now, the good news is that there's only one OBGYN office in town.
Yeah.
So, that would be where you could consider it.
Okay.
But yeah, it's a simple process.
Sure.
And we know, statistically, it's been proven that if a woman sees that, they are going to be less likely to terminate, more likely to seek help, more likely to get less incidents of prematurity, less incidents of issues and concerns and problems. And just the process of dating, how complicated that is when a person doesn't even know what their last period was.
Right.
They may not even know what a period is.
Right. Absolutely. That is something I can definitely look into. And I with those contract services in 1151, I could probably make that work as long as I can just get one of those agencies to take it on. Our medical insurance liability and everything, I don't know how they work if we hire somebody, a tech to do it on our side. So I'll look into all that. I'll figure it out.
Well, the individual is going to be insured.
Correct.
So, you have liability on your truck.
Right.
That's not it.
Right. I'll definitely look into it and see how, try to make it work one way or the other.
Okay.
Yep. So that's it for 1161. Any more questions on that one?
Anything else?
Yeah, Fund 4014, that is a TV fund. And that fund is kind of interesting. The way I understand it.
The mosquito fund.
I've never understood. That one is a tax-based fund. We're one of the few counties, I think, left in the state that has this type of funding for the mosquito control program. It is one that traditionally is struggling to actually meet the funding that we request. So we may be approved for $70,000, but we may only get $40,000 by the time the year ends. So this fund is constantly shrinking. So what I'm doing is I'm trying to move it into 1161 a little bit at a time just to deal with the shortfalls, because they can't even cover salary half the time. So, and it is what it is. The mosquito fund, it's all about mosquitoes. We all use spraying machines. So if we find West Nile in our community, we trap all season long. If we find an area that has West Nile, we put signs up in the neighborhood, we put our digital board out there saying we're gonna spray on such and such night, just to knock down that adult population. But most of our mosquito treatments is water sliding. We try to take care of them before they become adults. It's more bang for your buck. I mean, I can throw one of those dumps out there and knock off a million mosquitoes, but if I'm using that machine out there, you know, $50 chemicals for 2 miles, it's not as cost effective. So we only use that when we know we have West Nile positive in a specific area in the county. So that's basically all that fund pays for, is all the mosquito work. It's mostly chemicals. And we try to use, we use no organophosphates or anything like that. We against anything that remotely causes such serious environmental damage, but you know, it is a pesticide, and we have to have a license and all that. So, but all our folks are licensed to do the work.
Any questions?
All right, 4014 is TB fund. As I was saying, that fund, the way I understand it from 2 administrators ago, the American Lung Association had a chapter in Clark County, and it dissolved. So they took the remaining balance of what they had in their fund and they gave it to the health department, and that fund has existed ever since. So the $20 fee that we charge for TB tests goes back into this fund, and we use it basically to buy the tuberculin, the test. And we use it to buy the supplies, the syringes, and everything to do the testing and all that good stuff. So it's a fund that's been around for a very, very long time. And it's self-supporting, it's not tax-based, it's all fee-based. Any questions about that one?
Are we seeing any increase in incidence of TB?
Yes. Yeah, we monitor, I would say 3 to 5 individuals a year that are infectious. So in those instances, we have to do direct observation. We have to watch and take their bills in person. Sometimes we can do it through a video, but most of the time it's in person. The first 2 weeks, 2 or 3 weeks, I have to do that in person. And then it can go on for 6 to 9 months that we have to do this, depending on the regimen of antibiotics they were prescribed. And of course, there's a shortage of some of the antibiotics we need, so that's causing some other issues. Yeah, I know 3 to 5 patients doesn't sound like a lot, but when you're having to go 6 to 9 months every day, checking these people and watching them take pills, it becomes intensive labor-wise. So, and you know, I think it's going to continue to increase. And the other problem we know too is a lot of physicians out there just don't know a lot about TB. It's just, you know, and we struggle getting these individuals into care from the pulmonist, and we get it done, but it's just one of those that, you know, we just don't think about it anymore. It's kind of like rabies. Every time we have a rabies incident, you know, we're constantly having to deal with the physician's office explaining to them, well, this is what you need to do for prophylaxis and all this other kind of stuff. It's one of those that's just so rare in a practice that, you know, it just takes a lot of effort on our side to educate and make sure everything's taken care of. Any question about that one? 8204, that is the Strength Services Programming Grant, and that fund is used for testing mostly for HIV, syphilis, gonorrhea, chlamydia. You're probably aware, especially our physicians are aware, that syphilis is I wouldn't say exponentially growing in the county just yet, but it's definitely growing. Statewide, it's growing. We're seeing congenital syphilis now. So it's very important that we have these programs in place so people have the opportunity to get tested, you know, privately, and it's available and it's at no cost to them. There's no barrier whatsoever.
So this isn't the syringe exchange?
No.
Okay.
No.
You know, again, going back to the prenatal stuff, you know, if you got a patient who's pregnant, do the ultrasound, getting a baseline panel of blood is also critical for typing EDRLs, HIV testing, all that stuff is just, I mean, you gotta capture the audience,
Right.
get as much information as you can.
Right. And that's what the state is really pushing us to try to do, is make sure we're doing syphilis testing in that third trimester, is make sure that that's happening, because there is some barrier there right now to that. So, and that's what some of these dollars 161 is going to help make sure that we bridge that barrier as well. As far as your question goes, is for the screen services program, those folks will help with that program, but it's not tied to like buying any syringes or anything like that. But that program, they go out, they go to recovery centers, and we offer testing for Hep C and all the other stuff. We go to colleges, you know, we try to make sure that we're available to the community. We try to get in their backyard and make it as convenient as possible. So that's why it's outreach. It's not all just here. It's out in the community, different fairs and festivals. So, any questions about that one?
So it's got its own money though.
It does.
Okay, and is that from a grant?
That's correct. Yeah, that's correct. I think almost all of the rest of these are grants. There's one local fund at the end. The rest are all grants.
Reoccurring grants.
Generally speaking, yeah.
You guys gotta do the work to do.
Yeah. Any questions about that one? No? Okay. Fund 8205 is the ECHO grant, and basically it is an opioid grant. And what we do with that is currently we are contracting with LifeSprings to offer peer recovery coaching for individuals that are struggling with substance use disorder. So that's not done here in the health department, because individuals are coming here for the strength services program are obviously not recovery. We're trying to get them there, but then we get them into the next step of recovery, and that's what this is about. We also will fund PulsePoint, which is our interactive app for CPR notifications, which I'm sure most of you are very familiar with that program. PulsePoint now, or will be shortly, you can co-locate Narcan and stop the leakage. So you'll know when AED pops up that it has Narcan in it as well, and it has stop the leakage in it as well. So we're trying to make sure that we're, you know, trying to get all that stuff up to date in our systems. Just kind of a neat story. It happened, I think it was late last year. We had an individual in Boerner, Indiana. It was two individuals in the vehicle. One of them had overdosed and was unresponsive, had severe difficulty breathing, if not breathing. And they went to the PD in Boerner. When the PD didn't have any Narcan, when the call went up to Boerner High School, and they had Narcan in school, and I believe it was the vice principal came down and administered Narcan and saved that person's life. And that's because of the training that we're doing with this kind of grant. We're training people how to use Narcan. We're trying to make sure that they stock it, understand it, know what it's for. We're training CPR. We're really trying to build a base of lay responders out there, which is going to help offset our ambulance issues at home. So that's kind of the point of this grant. Any questions on that one? Okay, 8206 is a grant. That is our Safe Sleep grant. Basically, that one, it's a loan on their back in a crib. We try to get that messaging out there. I know at one point in time it was infants were on their stomach, now it's on their back, and we're trying to re-educate the community at large about making sure we have safe sleep environment. So what we do there, we have an individual that goes over to the hospital at least 5 days a week, if not more, and new mothers, they go in there and talk to them about, you know, hey, this is how you should put your child down for rest. We give them a sleep sack, so they're not using blankets where the child suffocates. We give them, you know, a sack that sometimes says the side up, that kind of thing on there. So basically just making sure they're aware of what they should be doing. We've now instituted a program too, where we're going back out 3 weeks after they get out of the hospital if they want us to. We're gonna go to their home, go over safe sleep again, find out how mom and dad are doing. You know, maybe they're struggling with formula, maybe they're struggling with this or that, or this, whatever issue they might be having. We're going to kind of do a social work kind of thing and check on them. We're also doing a postpartum evaluation on them while we're out there as well. Car seats has been kind of linked into this. We've had individuals, I think 3 now, individuals were leaving the hospital to buy a car seat. So we got a grant to give car seats out to individuals that need it, that are, you know, financially unable to purchase the appropriate seed. So we've done 3 of those so far, 3 if not more. And we're doing car seat checks for individuals. So I don't know if you noticed or not, but it's been a while since I had a car seat in. I got to tell you.
It's hard.
You look at that manual, I'm like, oh my gosh, it's a car seat.
It's a car seat, yeah.
But at any rate, so we're doing that as well to make sure we're trying to make sure we reduce our injury and trauma in the county and making sure that children are being taken care of. And the other thing we're finding too on these checkups 3 weeks after, we've gone to 2 homes where the individual does not have a pack and play or crib for the child. They're letting them sleep in the car seat, and that's a huge negative. And we really should not be doing that. So we now have a program to get individuals that cannot afford a crib. We give them a pack and play so they have to stay fresh sleep as well. So our person has all that. They just go out there, it's readily available. They see them, they take care of it in that instant. So that's kind of this grant. That's most of this grant is about. Any more questions on that one?
Questions? Ready to move forward?
Next one is the STD grant. So this one is a grant that we got, I want to say maybe 3 years ago. I can't remember how long it's been about that one. That one is more focused on STD testing. So if somebody walks in here, they need an STD test, HIV test, syphilis test, whatever, and it also helps with contact tracing. So if somebody comes in here and we identify them as having syphilis, then we start going through to find their partners and reaching out to tell them they need to test it. We also do treatments here as well. Our nurses take care of the treatment when it shows up. I'm trying to get us to where we're kind of a one-stop shop when it comes to all this, because like you said earlier, captive audience, when they're here, they've been identified as having a disease of some sort. I want to be able to take care of right then and now, because the last thing I want to do is say, well, we'll get you an appointment 2 weeks out from this provider, because there's a good chance you're not going to make that appointment, and then it's going to continue. So I'm really focusing on trying to get this to be, you walk in here, beginning to end, that day, you will have everything you need to address the issue. So, and we're getting very close to that. We do that with our HIV programs, we do it with the STD programs, we're working on our child health programs. So we're moving in that direction. So I'm hoping with this additional funding, we can shore up some of our gaps when it comes to that stuff. Any questions on 8207? 8212 is the biotourism grant and the City Ready Initiative grant. So this is actually 2 grants that we won. This grant is, there's a base grant, which every county could get if they wanted. It's like $25,000. And then the CRI grant is because we're next to Louisville, we get additional money because we plan with them in case something should happen, because obviously if it's happening to them, it's happening to us. So this grant has personnel in it, and we use it to buy equipment typically, like 800 megahertz radios. We use it to buy, like lighting for if we're doing a clinic outside a parking lot somewhere. During the Henderson tornadoes, we had bought generators with this grant, so we're able to get the generators out to the community stations. So, where people are kind of home to sleep that first night, making sure they have power. So that's what this grant does. And then it's mostly equipment and salary. Supplies, it buys stop and bleed kits that we can give out to the community, especially our schools. Definitely trying to get stop and bleed kits in our schools, and we're definitely trying to teach teachers how to do it. Just because of the issues we have with gun violence, we want to make sure that we have all the equipment in the schools that we can and the training that we can. And heaven forbid it should happen in our community, we want to be prepared for it as much as possible. So that's it for that grant. Any questions on that one?
Anthrax?
Anthrax, it's
I remember it.
Yeah.
Was it about 7 years ago? There was an anthrax.
Yeah, it was 2000, right after 9/11. So, I was on call.
Yeah, and at some time it seemed like somebody said that, like the banks that have the drive-through, they were gonna be able to pass out anthrax at the drive-through.
Yeah, there's a plan for that. There's also planning for it to be distributed through the postal service, which I don't know about that right now. But, and then there's with anthrax, we have a little bit of time with anthrax. We can do sites across the county and get Cipro to everybody that needs it. The smallpox is the one that's more challenging. We only have 72 hours to get the community dealt with and vaccinated. So we also plan for that as well. So
It's all in the same.
It's all that funding comes from this. This is a CDC partnership grant. Fund A218 is outreach. Again, this is one where it's testing for, it helps pay for the STD testing, supplies, and all that stuff we need to do the work. It also, I believe it has an employee as well. We have several individuals in this program, not this program alone, just the STD program, because the contact tracing is so expensive. You get one person, it leads to the next person, that person leads to the next person. So we have to have a lot of individuals working to rein this in quickly. Now this one is a little bit different. It deals with STD testing, but it also is a linkage to care. So if you have an individual that is living with HIV, they may have fallen out of the system for whatever reason. And there's a lot of social networks out there that can help them, in that situation. But, just as you can imagine, the mental strain of dealing with that, people fall out of the system. So this person's responsibility is to find those individuals, bring them back into care, kind of get them stabilized. That way, again, it's helping them, but it's also likely reducing transmission within the community. So that's what this position is for. It's kind of dual position. Any questions about that one? A234. This is primarily focuses on HIV. Again, individuals living with HIV, they need a lot of social support, generally speaking. These are non-medical case managers. So what they do, they basically make sure that anybody that needs care for HIV, they're making sure that they have access to a doctor who specializes in it. They also take care of the social aspects. Maybe they're having trouble getting housing, maybe they're having trouble getting utilities taken care of, that kind of thing. Again, it's all about making sure we're stabilizing the individuals, so that way they're making, healthy choices as far as what they're doing in their lives. So they spend a lot of time just basically connecting individuals to the appropriate care they need.
It's a large fund.
What's that?
That's a pretty large fund.
It is. It's very much so.
And that's a federal grant?
That is a federal grant.
If there's, just to educate myself, if there's problems in Washington with passing budgets and things like that, do these grants dry up? Okay. Is this a big chunk comes every year or comes every month or?
These are all reimbursable grants. The county has to front the money, then I submit reimbursements to the state for reimbursement. Yeah.
Okay. And it goes through the state?
It goes to the state. So it goes from feds generally to the state and down to us. The state is the pass-through.
Okay.
Yeah.
Of the federal money?
Correct.
No.
But we report directly to the state. So.
Thank you.
Sure, absolutely.
That helps.
Any questions on that one? All right, Fund A238. This is a new fund. This is a fund that actually is expiring out at the end of this month. But it is a fund that is deliverable based. So this is a grant to where we meet certain deliverables. They give us a check for $110,000 to do this and that. So we have carryover dollars in this fund. So what we do with this fund is really to help out the schools, the school nurses, the schools in general. So we're spending dollars on, vaping education, making sure teenagers and those in late elementary school are being made aware that vaping is not a good substitute for cigarettes. AEDs, I've really been trying hard to make sure all our athletic facilities have AEDs on site. I mean, how many times have we seen where a high school athlete has collapsed on the field? And it just makes no sense that we don't have AEDs at these facilities. So we're spending a lot of dollars making sure that they're equipped with AEDs. Stop and bleed kids come out of this as well. Training, we train teachers, CPR, we train teachers on stop and bleed. Training costs comes out of this fund. Vaccination clinics come out of this fund at the schools. EpiPens, some schools can't afford to buy EpiPens, so we try to make sure they have those as well. We're trying to make sure they have all the emergency medications in there. Some schools don't have albuterol for asthmatics. So my daughter is asthmatic, and she forget her inhaler. It'd be nice if the school nurse had access to one and trained on how to use it in that instance. So if the school wants that in their program, we will help them get that in there and help purchase those for them when they can afford it. So we're really spending most of these dollars are spent propping up the health services in our school systems. And it's private, public, charter, all of it, doesn't matter. And I gotta tell you, all the schools are doing really well. The school nurses, they have meetings with them now, our nurses, and the communications have really gotten well. They're all working very well together. The schools are sharing resources now. So this fund has really done a lot to bring schools together. So very helpful, very impactful fund. But any questions on that one?
Yeah, under, contract services, 200,000. Is that you're contracting outside people to do the work?
Yes. Okay. So like CPR trainings, data turnout, something like that. The cards at the meeting, we pay for half of that kind of fund.
Where do these people, the contract people come?
Right now we use primarily AD Safety Services. She's been doing stuff for us for years. You know, she does our medical supplies, some of it, you know, Band-Aids and that kind of thing. AEDs. So she's been working with schools for years as well. So she does, I think she does some of Fay County too. Yeah, that's what that one is. And then other contracts may be, I'm trying to think of some contract with the schools. If there's any kind of training, like specialized training, we can do that as well. We also support the school resource officers. We give them equipment to make sure they have what they need to protect students. That's another thing we buy on this fund. So it's pretty widespread, but it's all focused on schools. Very impactful, very much needed. We can buy hygiene products for the schools. You know, anything they need, we can get out of this fund and help students out.
I guess it's the big block to that would be the individual teachers that would recognize the need, know that this resource exists.
Right. And that definitely is a challenge. And that's one thing we're working with. We're working on launching a program called Gelada, and it's a referral system. So say a teacher is in the school and they got a child that is struggling with mitigating food insecurity, food needs, and they talk to the parents are really struggling for, you know, just because of economic reason they cannot get food in the home. Well, with the ROI from the parents, they'll go into this system. Within all the food banks will then be made aware that this family needs assistance. Well, then any one of those food banks can click, they'll take care of this family, and then the rest will drop off. Then I can get one of our staff to go in there and check to make sure that these referrals are actually happening. Because that's the worst thing about what we do in some aspects. We refer stuff out, we tell people to go here, go there, have no earthly idea if they ever made it. And it's hard for us to figure out what's working, what's not working when we don't have the data. Because I don't want to spend money on something that's not working. And the only way to know if it's working is if we can backtrack and see if those corrections actually happen. So we spend money on this program. I bought license for everybody in the county that we feel appropriately use it. So like Vice Springs, the schools, Family Health, the hospital, the ambulance service, the police. So say a police officer, you know, goes out and they Narcan somebody, but they refuse to go to the hospital. Well, the police officer can put in there, this just happened, this individual signed an ROI, they want help. Well, then we'll be able to reach out to them through our programs to try and get them in recovery. So that's another good facet of this program as well. It's also going to deal with if there's a domestic violence incident in the home, we'll be notified of it, and that way we can reach out to the school nurse the following day to let them know that that child may not be functioning at their normal level because they're obviously under distress. So that's another thing we're building into the system here because we're seeing more of that as well. So I'm trying to find a program to where we can all work together, play nice and sandbox together, and be able to like refer stuff out, but also make sure these things are happening because they don't want to refer into an individual or group that's not following through. Because it's hard enough to get somebody to A to B. Last thing I want to do is launch another barrier. So that's kind of what we're focusing on. Is just making those connections. Anything else in 1838? All right. 9151. It also is HIV prevention. It is a outreach. So we're making sure we're going out and offering free testing out in the community, not just here in the building, but you know, pop-up places and making sure that again, it's free, it's anonymous, it's easy, 15-minute test, And if you're identified, again, we'll have that one-stop shop, if you're identified as being positive for HIV, we work with Louisville, the group over there, as far as their infectious disease doctors. Usually by the end of the day, those connections are already done. Oftentimes medication's already started the day that we find out that they're positive. They're here, they find out they're positive, we're gonna do everything we can to get them taken care of where they need to be by the end of that day. Because again, once they leave, you know, it's harder to get them back in because it's obviously can be such a devastating thing to realize that you're dealing with. And we want to be there to support them. We also need to make sure that we get them on everything they need socially. So that's kind of what this fund does as well. Again, the whole thing is one-stop shop for us, is to make sure beginning to end, same day, everything's taken care of. Fund 9203. Now that is the fund that takes care of the buys syringes, the syringe program. It buys syringes for this SSD, the syringe services program. And then fund 9216 is an FSSA fund. It's a state fund. It's for mobile integrated health. And this is tying back into trying to reduce hospital readmissions, and also abuse of the 911 system. You know, individuals that are calling an ambulance because, you know, they have a headache or an ear or something like that. They may see that as a need to call 911 because they got a transportation issue. But with the ambulance situation, we really can't be spinning off trucks for things like that. So this individual is going to start working. We see an individual that's doing this often. We're going to send them out to do some home health a little bit, kind of talk to them and say, hey, you know, let's not do that. Let's actually talk to get you in primary care and get you the proper medication that you need or whatever you need to get kind of stabilized. So that's kind of what this program is focused on. It's really just trying to deal with individuals that may not be using all the systems the correct way and getting them into the proper channels that they need to be in. So they get all their needs met, but we're also not putting more tax on already tax services. That's basically that one's for. And it's also going to be about, you know, chronic disease management. You know, individuals are struggling with diabetes. It's going to be education. The individual does is actually a paramedic, so they can do an awful lot of stuff in the field for us. Yes.
Is this then at your discretion?
What's that?
I mean, is this grant at your discretion for things like that, or is this a grant that is specifically for people that call that don't need 911?
I mean, it's set up for like the hospital lets us
Okay.
know. They refer people and say, hey, this person was here like
Okay.
7 times for bloody nose. You know,
That's interesting.
that's what it's for. But it's also community based too. So like a fire department, they can go out and say, you know, this person keeps calling 911 because
Well, I'm thinking about
they
this.
need a,
I know a person that's doing that,
Yeah.
and she refuses to. She's being assisted living or something like that, and she refuses to do that. So she calls the fire department or the police department or 911 for every thing.
and that's where we would step in with this grant and we're talking to them and say, okay, let's identify a different route here. How can we help you with this? We see that a lot with lift assist like with,
That's what this is.
which, I mean, there are some instances where it has to be 911, it has to be called, obviously it's an emergency, but sometimes it's, you know, we need to look at, do you have the appropriate care in the home or where you're at? And so this kind of is a social program, social services type program, but it's also medical too. So we've had individuals that had trauma injury, they couldn't go back for follow-up care, so I could send our paramedic out there just to change a dressing for them, you know, until they could get to them. So it's just, I don't want to say it's home health because we're not trying to get home health, but we're willing to kind of bridge that gap a little bit so they can either get an appropriate home health or they just need to get back to the doctor and need a dressing change in between. They can't get there for whatever reason. That's kind of what it's for.
I would say one of the places this is really abused is in OB and labor delivery. Do you see that?
I haven't seen it just yet. This is relatively new and growing, but I'll definitely watch for it.
Well, and the scenario usually is that you've got a single mom.
Yeah.
The father of the baby is in or out.
Yeah.
she makes a call, I gotta go to the hospital. So she now gets, and it could be, you know, I think I'm aware, and she really isn't, but she gets attention from the father of the baby.
Yeah.
And then she can heighten that attention by calling an ambulance.
Sure. Sure.
So you know, it may be, it's beneficial to go through the OB offices, but definitely labor and delivery. I don't know that we ever knew that this kind of stuff was available.
And again, going back to that referral system.
Yeah.
Really, I'm trying to find a way to bridge all these great community partners that we have. There's some really good folks out in Clark County. There's a lot of good work being done, but there's no way to really just tie us all together.
Yeah.
And that's what I'm trying to do. I'm trying to find a way to bring all these people to the same table, because we may think, like you just said, you know, this program may exist, but they may not know this. We have to find ways to make these connections, because one, it saves money. Two, it just benefits the individual person's health. And three, it benefits Clark County's health as a whole. And when you're talking about economic development and all this other stuff, the baseline is your employees. If your employee base is healthy, then your economic outcomes are much better. You can have better outcomes economically with a healthy work base. So it all ties together. We just gotta work together. So that's all of them. So the budget for the total budget, all the grants and the levy funds, is $5.6 million. And this is due to the council, or to the auditor's office.
And that's based on anticipated.
Yeah, there's still several steps. It's gotta go to the council for approval. You know, they can say, well, we're not gonna do $20,000 of contract services, we'll do 15. So there's that process. And then also the state budgets have to be done as well. So there's two different tracks that happen with this, and at some point I have to merge all this together. So the county could approve this budget, but the state may not approve this side of the budget because it's grants, they control the budgets. So after everybody does their approvals, I then have to reconcile all this together to figure out what I actually have. So it's a lot of fun.
You want approval on this?
Yes, I'll need approval to submit this to the auditor's office.
Do you need a quorum to do this?
I do. Or you here, we do it.
And we have it here.
I move that we accept the budget.
Second.
And we have a motion and a second. Any discussion? A second. Hearing none, call for the vote. All those in favor signify by saying aye. Aye. You got it.
Awesome. Going to look on agenda is next health board meeting. I know we talked about loosely the first Wednesday of every month, which I believe is the 3rd of July. I do think we probably need to try to have a meeting. The EMS advisory subcommittee is going to meet on the 25th. And I know Dr. Yazel and some of the other members have already sent me some emails with some of the changes they want to make to the safety ordinance. And
They want to make what?
they want to make some changes to the safety ordinance, the public safety plan, which is a commissioner ordinance. This is 2014. I've looked at them. I really think they're going to be beneficial changes. I just need to have legal look at some of the stuff that we want to change. So I think they're going to kind of finalize some of their suggestions on the 25th. I'll have legal take a look at it to make sure that we're good on our side. And then I will take that to the commissioners after you approve their recommendations, hopefully on July 3rd. So
Okay.
June 3rd?
You need to vote on the date?
Yes, I do.
Okay, so we're talking July 3rd for our meeting.
Yes.
Okay. Have a motion to set the date for July 3rd for the next meeting. Have it down here. Do I hear a second?
Second.
We have second over here. Any discussion? Hearing none, call for the vote. All those in favor, signify by saying aye. Aye. Unanimous.
All right. Did I assume 8:30 again? 8:30?
Yeah.
So do you want to try and meet monthly for the year, or?
Well, like I said, tentatively, we talked about the board, just kind of keeping it on their calendars, and then every meeting we're kind of discussing whether or not we need to have the next month meeting. I do think we need to have this July meeting. And the reason I say that is if the advisory committee really nails down what they want to change in this ordinance, and I think they will, I'd like to get in front of you all for approval. And then we take it to the commissioners, but I do believe since this ordinance is punitive, I gotta check on this, but I think because it's punitive, it has to be posted for 30 days for commissioners to take action on it. So we need to make some changes to this public safety plan to deal with our current EMS situation. So I want to move this along as fast as I can, but obviously we're going to be prohibited by.
Have you always worked with the commissioners on a regular basis?
Yeah.
Okay.
Yeah. We have department head meetings every other week. They're having one today.
Okay.
But, yeah.
All right.
Yeah, they started that a couple of years ago. I mean, it's very beneficial.
Okay, so
Yeah,
It's relatively new.
it's relatively good.
Okay.
Yeah, especially for us. I mean, the health department, we didn't go to any of those meetings during COVID or anything because we had so many meetings going on. There's no way. But in the last year or 2 years, I've been able to go to a lot of them and be able to talk to them.
anything else?
That's it.
Adjournment? Oh, I'm sorry, go ahead, Art.
Do you want us to keep this?
Yes. Yep. Just keep in mind that could change because again, there's 2 different tracks that people have approved this beyond you. So, but I'll let you know if anything significant changes in that budget.
Anything changed from the time I received mine home? Okay.
No.
So motion to adjourn?